Welcome back. Becoming a main concern in our country, inflation is affecting nearly every part of our daily lives. However, inflation may have a unique effect on vulnerable populations already struggling with food insecurity. Joining me to discuss the effect inflation has on these vulnerable populations and their access to food is Emilio Tavarez, Director of Advocacy, Policy, and Research at Hunger Free America. Emilio, thank you so much for joining me.
Hi, good morning. Thank you for having me.
Now, can you tell us a little bit more about your organization, Hunger Free America?
Yeah, so we started out as the New York City Coalition Against Hunger over 10 years ago, and we changed our name about 6 years ago to Hunger Free America to take more of a national approach. So we're both a direct service and advocacy nonprofit organization. So we are nonpartisan. Our direct services include SNAP and WIC outreach, which I'm sure we'll touch on. But we also manage the National Hunger Hotline on behalf of the Department of Agriculture. And then in terms of advocacy, we focus on these programs and making them better. The scale of help that federal programs can provide versus charitable efforts is exponential. It's like about 17 times more assistance. So I'm proud to work here. I'm a social worker. I have tons of experience helping people apply for these programs directly, and I'm excited to share more information with your public.
Now, I love that you mentioned that your organization decided to take a more national approach because hunger really is a problem. I mean, globally, but definitely in this country, people would be surprised to know that so many Americans are going hungry. Can you explain what's the history behind the struggle many Americans are facing with hunger?
Yeah, and to give you some context and put some numbers on that, there's about 38 million Americans right now nationwide facing food insecurity. And in New York City, it's about 1.1 million, or like 13% of the population, pretty much. So it's a widespread issue, and it was a widespread issue even before the pandemic. The reality is that wages just don't go far enough. Like they're not high enough to be livable, particularly in a high cost area such as New York City. And now, inflation is here, or it's always been around, but like the cost of rent, healthcare costs, childcare, food, transportation, right? Like there's so many different costs that are all going up that it makes it that much harder for people to eat. I think one of the things is that that affects people is that food is one thing you can cut, right? Like some people can say like, paying rent is more important, so I'm going to skip these meals, right? Like you can't really do that with other costs. And so the other side of poverty and hunger is that people also have a lot of health issues because of it, right? Like if you're skipping meals or you don't have enough money to buy healthier food, right? Like you have too many mouths to feed. And so you want to stretch that dollar out as much as you can. I think all of those are barriers to help getting people out of food insecurity.
I really like that you mentioned that because I never thought of it that way before, how people will sometimes just decide, okay, well, maybe I can skip a meal or, I never thought of it that way. Can you tell me a little bit more or has this been something that you've seen, throughout your work?
Well, yeah, I mean, it's the difference between, getting evicted and like spending a night with a hungry belly, right? Particularly with parents, households with children, we know that they do, the parents will stop eating to make sure that their kids are fed. And so they try to protect them in that way. But then the parent, has all these health issues that may prevent them from working. And then B, they may think that they're, sort of shielding their children from the emotional aspect of being poor. But we know from research that children know, like if my dad is skipping a meal, like the children can tell or they notice. They can see that the fridge is empty, right? If they want a snack and they go looking and can't find anything, like there's a lot of different ways that it shows up. And so, I'm going to go hungry or my kids are going to go hungry, but at least we have a roof over our head, or, my kids need, their computers for school. So I'm going to skip a meal so I can pay the light bill. So I think there's a lot of these negotiations that people have to make that are really stressful.
Now, as you mentioned, cost is a major component as to why people don't have access to food, and this is often categorized as food insecurity. Can you tell me more about how NYC is struggling with food insecurity?
Yeah, so like I mentioned, it's about 1.1 million New York City residents right now. About 12% of the city, 12 to 13%, is estimated. And so it's a major issue. You would think that in New York City, we do have a lot of extra sort of programs to help people, low income people. There's like a childcare subsidy. There's like a, subsidy for Metro cards, right? There's like rental assistance. But the issue is that there's so many people in need that these programs don't have the bandwidth, the capacity to really help everybody. SNAP and WIC are federal programs, so they have the ability, SNAP in particular has the ability to expand with needs. So there's never the fear of like, oh, like it's going to run out of money, right? But with a lot of these other programs, WIC included, there is that sort of cap. And so another issue is that people just don't know. There's a lack of awareness about all these programs, right? Like I only learned it as I was, helping people apply, navigating different websites. So, some people can navigate a website fairly easily on their own, but a lot of people can't, right? Because of lack of education, not enough experience with technology. And so there's a lot of outreach that is still needed to connect people with the available resources.
Now, according to some of your earlier research, the Bronx remained New York City's hungriest borough, which unfortunately isn't a surprise to many of us. The Bronx struggles the most out of all of the boroughs. Can you explain, what could be some factors that are contributing to those numbers?
Absolutely. And there's a lot of layered factors. And I'm a very transparent guy, so I'm just going to go ahead and say that I think the root of it is just structural racism. The Bronx is known to be a high concentration borough of immigrant communities, Latinx communities. And I'm actually coming at you from the Bronx right now. I live in the Bronx. And so there's a disinvestment in those communities, right? Like people focus more on Manhattan as sort of like the city, and transportation out here is really tough. Getting to a food pantry or soup kitchen or going to a government office can involve like two buses and a train. And so imagine carrying like heavy bags of groceries on two buses and a train to your home. There's not as many nonprofit organizations or government offices in the Bronx as other parts of the city. But also, I think there's a stigma associated with seeking help, and that is particularly prevalent among immigrant communities. The biggest thing I hear is like, I'm not, I'm an immigrant, so I'm not eligible, which may or may not be true depending on the program you're talking about. Like SNAP is eligible for many immigrants, and WIC doesn't even have an immigration requirement. But from the community's perspective, it's like, oh, I don't want to be a burden, or there's people who need it more than I do. So there's all these sort of excuses for why also people don't seek out help. So I think it's both a structural problem, like we need more services, more transportation for the Bronx and Brooklyn in particular as well, the outer boroughs really, and as well as, we need to do more outreach so that people have the right information and will take advantage of what's available.
I can also add to that. I think a lot of people have like too much pride and they don't want to feel like they're accepting a handout, and they want to, I came here and I did this. So I can definitely understand where you're coming from and what you're saying right there. Now, some families are fortunate to rely on benefits like SNAP and WIC that are available. Can you explain how those families are also affected by inflation?
Yeah, and to your point, I think part of what people don't realize about that pride issue is that this is why we pay taxes, right? Like our tax dollars are going to fund these programs. And so everybody that works, most households on SNAP and WIC are working households, right? Often they have like 3 or 4 jobs and none of them pay enough. And so inflation, impacts those households because they are working, right? And even if they are getting benefits, the cost of everything else is going up. So their benefits don't go as far. Particularly, through the pandemic, there's been enhanced benefits, new programs like pandemic EBT for households with children in public schools. But, what I've heard from community members in the Bronx is that even though there were higher level benefits, inflation costs made it almost like nullified them in a way, right? Like the benefits went up, but all the costs went up, and so many people didn't notice the difference. The tax credits, like the earned income tax credit and the child tax credit, I think had a higher impact, so people did notice that a lot more. Were able to save or pay medical costs, like think a little bit more long term with that. But all of these programs are temporary, and so we're already seeing, benefit cliffs impacting people. where they're losing, whatever subsidies they had, or they have to sort of, like school meals now, right? Like, am I getting reduced price meals? Is it free for everybody? So there's a lot of uncertainty that inflation is also sort of exacerbating into a lot of, hardship.
Now, SNAP and WIC are government funded programs. How should they respond to what's going on with inflation in our country?
So I think a lot of the changes that were made during the pandemic should be made permanent, right? They increased the benefit amounts for households. Eligibility was loosened a little bit for college students. Can you believe college students, if they were studying full time, were also required to at least work 20 hours a week to qualify for SNAP? And so there's a lot of rules like that make no sense, because if you're going to school, you should have a program to help you, pay for your food while you do that. And so pandemic EBT is something that has been extended, but it should just be a permanent program. And so a lot of the improvements that we saw during the pandemic were improvements we needed long before now, flexibilities with the interviews, with the work requirements, more virtual services. A lot of people, like I mentioned before, just can't travel to the office, right? So being able to take pictures on your cell phone of your documents and submitting them to whatever app or website was required, I think is a lot easier for a lot of people. But also we will always need in-person services, particularly for people who are not tech savvy. So like older adults who may not be as familiar with a smartphone. Or also what I think a lot about is people who are homeless, who are houseless, whatever word you want to use, but don't have a permanent home, may also not have internet access or a smart device, right? Or minutes on their phone. So there's a lot of we want to provide service to everybody in whatever way is most comfortable to them. And I think the other thing is that people spend a lot of time sharing the same information with multiple programs. So for example, SNAP and WIC basically have similar eligibility, right? Income guidelines, where do you live, permanent address, who's in your household. And so it's up to the client to provide their documents to each agency separately, whereas we think they should submit their application and documents once and get all the services that they're eligible for, so that they can save time and money that they can spend on other things.
Now, can you just let everybody know how they can stay up to date with Hunger Free America and all the resources you provide?
Yeah, absolutely. You can go to our website, hungerfreeamerica.org. We have the Hunger Hotline, which is it's on our website. Sorry, I don't know the number off the top of my head, but basically we have SNAP and WIC enrollers that help people remotely. So if you want to talk to someone and just find out if you might be eligible, you can give us a call. Also, we have a couple of field offices, one in the Bronx on Sheridan Avenue, and one in Queens, which will be closed for the month of August, but will reopen in September. And so Hunger Free USA is our Twitter handle. We provide updates on all these federal changes to these programs, as well as changes to our services. So please feel free to reach out to us.
All right. Amelia, thank you so much for joining me.
Thank you all for your time, and hope to see you soon.
We'll be right back with more Open BxRx Tuesday.